I'm Nanika. I'm at the ninth International Healthcare Conference organized by VOH. I have the privilege of having Dr. Ko with us today. So she was recently in our panel discussion where they discussed a lot about the resilience against the future health crisis. So I want to ask a question relating to that to you, ma'am. So considering your experience in emergency medicine, what are the key components that hospitals should focus on to build resilience against the future health crisis?
Thank you so much for your question, and thank you for having me here to share. I work in emergency medicine. I'm an emergency medicine specialist and so specialized in disaster response. And we're here to talk about building up hospital resilience. So this will definitely be related to the response to disasters and crises. So there are a few things that we do when we are trying to build up a hospital or we say like a medical facility in response to disasters. So the most important thing we were talking about is training, right? So training comes in different components. It comes in training on our medical staff. It comes on training with logistics or what we say HR, even finance. All right, so this is one part. So hospitals should be trained in ways so that they can respond rapidly when there is a disaster. When we say disaster, it could be a natural disaster. For example, when an earthquake hits, how do we respond to the surge of patients coming in? It requires a lot of simulation drills when there's nothing going on. So this kind of the drills will help us build up the capacity. The other thing is simulation drills between hospital and outside the hospital. So when there's a mass casualty event, like I said, it could be from a natural disaster. It could be from a human-borne disaster, for example, explosions. It could also be for example, we recently had a train derailment, so that ended up in a mass casualty incident. So not only does hospital have to build up its own capacity, but we do have to build the capacity to reach outside. All right, so when we're emergency medicine is not just in hospital, but also outside the hospital, what we call pre-hospital. So training the paramedics and even training civilians will be build up the capacity and the resilience of the community to face disasters. For example, we've been training our civilians, are educating them on stop the bleed, how to use tourniquet and things like this, so that they can help also when there's a mass casualty event. So these kind of training programs is the most important thing in building up capacity. The other thing is exchange programs, and because we can always learn something from other hospitals and other countries. So cross-border trainings will help us build up our own capacity and our resilience also.